Hello everyone, welcome to another lecture, and today we'll discuss something about the principles of development and the facts about development that you should need to know. And so we'll begin. So development is actually defined as the maturation of function and acquisition of new skills, which happens due to the maturity of the neuromuscular system. And it is different from the growth, where there is hypertrophy and increase in cell and tissue size. So this is the lecture about development. So there are some rules of development which are followed by each and every person, and it is constant and it does not vary from person to person. The rules are very fixed. So first one is continuous process, and development is a continuous process which starts in utero, and it continues until the child is fully developed or all the milestones are gained. And there is entirely developmental stages. So it is a continuous process and it occurs every day in the child. Now development depends on the functional maturation of the nervous system, and there is no amount of skill that a child can develop as a development if there is no functional maturation, if there is no maturation of nervous system. Specific areas of brain should be developed in order to achieve the following milestone, and no amount of practice will help the child achieve that milestone if the specific area of the brain has not developed. The third the rule is the sequence of the milestone remains the same in all patients. The time frame may be different. In some patient it may be achieved early, in some patient it may be achieved later, but the sequence remains the same. As in, the child first learns to sit, and then only child learns to stand up, and then the child learns to run. There is not possible that child learns first how to run and then child learns how to sit. So the sequence of milestone remains the same, be it gross motor, be it fine motor, be it psychosocial, be it language, their skills. So you have to remember that. Now, the fourth one is the direction of maturation is cephalocaudal, which means that first the child learns to have head control, then the child learns to sit, and then the child learns to stand. So there is cephalocaudal direction of the maturation of the skills or development, and that is followed in each and every one of child. The fifth one is there is losing of primitive reflex is required before the milestones are achieved, meaning that some primitive reflexes like asymmetric tonic neck reflex or palmar grasp has to be lost in order to achieve rollover. See, ANTR is essentially to prevent rollover of a child that is in its cradle. The primary thing of ANTR is that if you turn the head of a child in one side, there will be extension of the same side hand, which will prevent the rollover of the child due to extension of the hand. But now, if the child has to, learn how to roll over, then, this ANTR has to be lost. In the same way, if the child is to be using pincer grasp, the palmar grasp has to be lost. Now, palmar grasp reflex is, why it has developed. Palmar grasp developed because, those monkeys who carry their children between their chest. So what happens is when they jump, these children may have a risk of falling down. So in order to prevent that, the palmar grasp was developed by the nature so that the child doesn't fall off. When you check the palmar grasp in a child, in an infant, the grasp is so strong that if the child holds you like this and if you pull your finger upwards, the child will hang to your finger by every last strength the child has. And the child's one side will move off the horizontal table on which you are examining him when you pull the finger up. So this palmar grasp is a safety precaution which later gets converted into mature pincer grasp. And as you know, humans are the only animals with opposable thumbs. So that is why pincer grasp later on develops. And the last feature is that initially disorganized mass activity is later replaced by specific action. So what does this mean? When you show a 3 week or 3 month old child a shiny object, or you play something, the child will, jump in joy, move his hands, move the hands like this, move the face, will use the legs and also move the legs up and down. So the child will, be very very happy, and the entire body will move. So this is a disorganized mass activity. While in the later on, when the child is of 3 4 5 years, the child will ask you for the thing that the child wants. So at 15 months or at 18 months, the child gets one developmental milestone where the child points to the object the child wants. So that is a specific action that is gained later on as the developmental process is achieved. Now, what are the factors which are determining the developmental process? So, firstly, we'll discuss perinatal factors. So, genetic factors are important where there are trisomies or there are other syndromes where there is, some component of brain involvement, or there may be issues in brain maturation. The child will gain the developmental milestone slower. So the process is interrupted in utero, and it carries on postnatally also. Maternal factors are very important where maternal drugs, malnutrition and disease all would finally sometimes lead to developmental delay. It is not always the case. Not all patients or not all children of mothers who do drugs or all children of mothers who are malnourished will have uh, developmental delay, but they are contributing risk factors. Now, what are the neonatal factors? If the child is IUGR, or if the child is premature, or if the child has perinatal asphyxia or hypoxic ischemic encephalopathy, then the damage is there because of the brain immaturity. And as you know, in prematurity, there is increased chances of intraventricular hemorrhage. Even sometimes there is in neonatal period bilirubin induced brain damage or bilirubin induced neuronal damage, or there is a hypoglycemic injury in the neonatal period, or if there is hypocalcemic injury in the brain, or if there is meningitis which causes brain injury in the newborn period, or if there is a presence of hydrocephalus which would lead to brain injury. So all these factors have a very prominent role in neonatal period, and they are, the insulting factors in the neonatal age group, which lead to static or progressive damage, which may lead to developmental delay. Post neonatal age nutrition, again, hypothyroid children. Hypothyroidism is the most common cause of preventable intellectual deformity in children. So, hypothyroidism, iodine deficiency, iron deficiency are preventable causes of developmental delay, and even vitamin D3. Vitamin D3, as you know, rickets children have pot bellies and they are hypotonic because the tone of the muscle are lost, and due to which the motor milestones sometimes take very long compared to the normal children. Infectious causes like meningitis that occurs later in life might also affect the child. Even encephalitis will also affect the child. Environmental factors are very rare, like mercury or lead poisoning, and this have multiple implications. And with nowadays increasing awareness, these heavy metal toxicities are now being well documented, and the meningitis and hypoglycemia may occur in the postnatal age too. Now, psychosocial factors are very important, like the cognitively deprived children whose mother do not give them, mothers or parents do not give them any appreciation, love, and time. What happens is, they advise to play with your child. So they advise that when the child, even if the child is in womb, you talk to your child because they can hear you talk. So all that factors are very important. And the cognitive, see, brain is like a muscle. You have to exercise it to develop it at its best potential. So cognitive depression is actually you are not exercising your child's brain as much as you should, and it may lead to developmental delay. Poverty, again, lower socioeconomic classes are have multiple of other the factors that we have seen previously. So all that will lead to developmental delay, violence and abuse. Again, the child will have multiple psychological abnormalities once the child faces violence, abuse, and even maternal depression. If the mother is not taking care of the child properly, then child will obviously have some issues while growing up, and there will be developmental delay. Now, there are four main domains of development, and fifth one is added, which is vision or hearing. And four domains are gross motor, fine motor, psychosocial, and language. And any two domains, if they are delayed, then we will call it as gross developmental delay because, global developmental delay, because G stands for global. And global developmental delay is that if two or more than two domains are involved, then we say that more than or equal to two systems are involved, then we'll call it as global developmental delay. So first we will begin with the gross motor milestones. So firstly, when you if you examine the child in primarily four position. So 1, 2, 3, 4. The first position is supine position. In supine position, you have a general idea of the child's tone, how the child is sleeping, and what is the position of the child. Okay. Then the second position is pull to sit. Pull to sit. Now, what is pull to sit? I'll show you the photo where the child is pulled by the examiner, and see this can be said as pull to sit. The image figure 3.4, where you catch the child when the child is horizontal and you pull up the child in from the sleeping position to a sitting position. So there you can see the presence of a head lag if it is present. If the child's head lag is there or child does not have any head lag. See again, the figure 3.2 is pull to sit. You pull the child to sitting position from a supine position with the help of pulling the child's hands, and it is called pull to sit. The third one is prone positioning, where you keep the child in the prone position and you see the child's position and the flexion of the muscles. And here you can easily see in figure 3.8 and 3.9. See here and here. You can see what is the position of the child. And if momentarily, if the child can, pull the head or, flex the head beyond the horizontal plane of the body, or take the body of the ground, or take the hips of the ground. So that is another potential position of checking the gross motor milestones. And the fourth position is ventral suspension. Ventral suspension, where you can see in this image. I will show you one image. In the image 3.6 and 3.7, you hold the child in your palm and you suspend the child in the air. And there you can see the flexor tone and the tone of the arms plus the tone of the head, or the head control if it is present or not. So these four positions are the primary positions where you examine the child, and all of them are important in development. So what happens is, when you examine the child in supine position and when you pull to sit the child, what happens is, initially when the child is a newborn, there is complete head lag. The head, when you pull the child up, the head will be dragged along with the rest of the body, and there is complete head lag. And after an age of 4 months, the child has no head lag. So at birth there is a head lag, but after the 4th month of age, the child has head control, and there is no presence of any head lag, and the child can easily pull the head when you pull the body upwards. Now, once you put the child in a sitting position, what happens is, the child can flex the head. This head can be flexed towards the chest after the age of 5 months. Okay, so at 4 months, at 0 months, there is no head control in neonatal age group, while at 4 months there is complete head control, and there is no head lag. Actually, there is not complete head control, but the word will be no head lag. And At 5 months, the child can flex the head towards the chest. So you have to keep this three position in ventral in pull to sit. Now we will go into examination in a ventral suspension. So here ventral suspension, what do you see is that when you hold the child in the ventral suspension, child can uh, flex the head and has some head control, so that child can momentarily put the head in one line compared to the body. So the child's body can be in one line and some amount of control has been established, and this occurs by 8 to 10 weeks. While at 12 weeks, what you see is there is absolute control of the child, and child can also flex the head beyond the plane. And at 12 weeks, you can see that the child has complete head control, plus the child can move the head backwards. Now, in prone positioning, again, we have to examine this two child. Here, what do you see is that at 2 weeks, at 2 weeks of the age, child has, child cannot lift the pelvis of the ground, and the legs are flexed like this. The legs are flexed like this, and the child is resting on the knees, and there is high pelvis. This position we call high pelvis and knees drawn. So this position is known as high pelvis and knees drawn, and this is seen at 2 weeks. While at 8 weeks of age, at 6 weeks of age, what you see is the pelvis is flat and the legs are extended. The legs can be extended. Here, see, the legs are flexed at the hip joint, while here the legs can be extended at the hip joint. As you know that in neonatal period, the child or the fetus is in a position of complete flexion. After 6 weeks, the hips are extended, and here at 2 weeks, hips are flexed. So as you can see, we have seen all the 4 position examination, and after that, again, we will see prone position examination in 3 ways. And here I would like you to remember 3 things. There is no push-up. There is an elbow or a half push-up, and a full push-up. So this is just a mnemonic to help you remember. So here you can see the child cannot push up. In figure 3.1, the child cannot push up because the child does not have enough maturity to push up. So it looks like the child cannot do a push up. So that is seen around 4 weeks. Child can momentarily take off the face. See, the face, when you keep the child, the face or the nose is not facing the ground. The nose is facing the front. So there is, lifting at 45 degree, but child cannot push up or child cannot take the chest off the ground. Okay. At 3 months, so here it is 8 weeks or 2 months. Okay. After 1 month, what happens is child is able to do a half push-up, where the child can, can take it up to the elbows. So half push-ups is child can do a half push-up very easily, and this occurs at 3 months. This is a position of half push-up, and this figure 3.2 is a full push-up where a child can take the chest plus abdomen off the ground. Okay, the chest and abdomen is completely taken off the ground. So that we will call it as full push-up, and that occurs at 6 months. Now, child can creep. As you can see in figure 3.13, child can creep with a knee elbow or a palm elbow position in figure 3.13, and child can learn to creep at 10 months of age. So these 4 milestones are again very important. How will you remember them? 2 months and 3 months, you have to add 1 month, then you have to add 3 months, and then you have to add 4 months. So here you have to add 1 month, you have to add 3 months, and here you have to add 4 months. Okay, so that is how you remember 134, and that is very important, and I hope you remember that. Now, when you check the child in a sitting position, what will you see? So in sitting position examination, in sitting position, firstly, you can see at 8 weeks of age, the child sits supported with rounded back, with rounded back. So I'll show you in the image. See here, the child will sit with support, but the back is rounded because the tone has not been achieved. While at the age of 4 months, so this is 2 months, at 8 weeks it is 2 months, at 4 months of age, the child sits with support with a straighter back, with straight back, straight back. Okay, so here you can see the child sits up with a straight back. It is not rounded, it is straight. At 6 months of age, you again add 2 months. See here, you have to add 2 months. So at 6 months, what do you see is that you can see the child sits in tripod position. So tripod position means the child takes support of one of the hand. So the child sits in a tripod position and sits with the support of hands. In figure 3.16, you can see over here the child sits with the support of hand, and it is called as tripod position. While at 8 months, the child sits without any support. You can see over here that the child sits without any support at 8 months. And then at 10 to 11 months, there occur 2 things that I want you to remember. Absolutely, you cannot forget that, and that occurs is one is pivoting and one is cruising. Now, what is pivoting and what is cruising? So pivoting is this. In figure 3.18, you see that the child's lower body is in one area while the upper body can rotate without rotating the lower body, and that is called pivoting. And you can see that when the child picks up an toy that is distant to the child, you can easily notice pivoting, and that occurs at 11 months. And cruising. Now, what is cruising? Cruising is the child takes support of furniture or the walls and walks with support, and that is what we call as cruising. So that are the important milestones whose photos you need to remember. That is why I have added over here, and here we will summarize everything in one picture. So at 3 months, here if you see table 3.1, at 3 months there is neck holding is present. At 3 months the neck holding is present. I'll enlarge this image for you. Okay, so at 3 months there is neck holding, easy neck holding. The neck holding starts, and again at what age is there complete head holding? So at age of 3 months you have inline, and the head holding completely occurs at 3 months of age. Then at 5 months of age, the child easily rolls over, and that is important. You remember at 4 months the child rolls over. Sorry, at 5 months. At 4 months, what did we see? So at 4 months, you see that child sits with a support, with straight back. So at 4 months, you remember that child sits with straight back. And at 2 months, child sits with rounded back. Child sits with rounded back. Yeah, so you can see that at 2 months of age, the child sits with a rounded, absolutely rounded back. And the child at 4 months sits with a straight back. And at 2 months, you also might remember that child cannot do a push-up, not push-up. And the image you might remember, the child is unable to do push-up at 2 months. And at 3 months, you can see the neck holding has been achieved. At 4 months, the child sits with a absolutely straight back. And that is the thing. Then at 5 months, the child can easily roll over. And at 6 months, the child sits with in a tripod position, as you have seen here. Plus, at 6 months, the child can do a at 6 months, child can do a full push-up. Full push-up. So let's summarize over here that at 2 months, what does a child be able to do? The child sits with a rounded back. Child sits with a rounded back. The back is curved. Plus, at 2 months, the child is unable to do a push-up. Unable to push up. And the face can be lifted. Face can be lifted at approximately 45 degrees. Okay. Now at 3 months, what happens? At 3 months, what happens? The child can do a half push-up. Child can do a half push-up, as you know. Child can take the chest off the ground. The half push-up that we have talked so much about. The half push-up is done at 3 months of age, plus the neck holding is achieved. Neck holding, complete neck holding is achieved. Okay. At 4 months of age, the child sits with a straight back. Child sits with a straight back, but with support. Yet there is still some amount of support that a child requires to sit. Now, at 5 months, what happens is the child learns to roll over. Roll over is present. Okay, and child learns to roll over. While at 6 months, what happens is the child can do a full push-up. Child can take the entire weight of the abdomen plus chest off the ground. Child can do a full push-up. Plus, what else can child do? Child sits in a tripod position. Tripod position. While the child sits with the support of his own hands, and the child can be stand. Child can stand with support. So standing with support is another milestone that child can achieve. And here you can see the image of stands with support. Here, image 3.19, you can easily see that the child stands with support. Now, after 6 months, where do we go? We go at 8 months. So at 8 months, child sits without any support. Child sits without any support. While at 11 months, you have pivoting and you have cruising. So this all things are, at around this occurs at 11 months. And by after that, what happens is at 12 to 13 months, the child can stand independently. Child can stand independently, and at 13 to 15 months, the child learns to walk without support. So you have to remember that child at 15 months, the child walks without support. See, here you take 12, here you take 15, and then you take 18. So at 18 months, so you have to add +3, +3, +3, and at 18 months, child learns to run. The child runs at 18 months, and again, after the child learns to run, then you have in years. So at 2 years, the child can climb upstairs. By 2 years, child what does the child can do? Child goes upstairs with 2 steps, 2 feet on same step. So how does child goes up like this, then like this, then like this. Child cannot go up like this. See, child will not go up like this. Child will go up like this. So 2 feet will occur on the same step at 2 years, and initially the child learns to go upstairs, and at 3 years child goes upstairs with 1 feet on the same step. So the normal walking up the stairs that you see in adults, that is 1 step on same step, 1 feet on same step. And at 4 years of age, child can child can move down. So downstairs occurs at 4 years of age. First the child learns to go upstairs, then only the child goes or learns to go downstairs. And at 3 years of age, child also learns how to ride a tricycle. At 3 years of age, child learns how to ride a tricycle, while at 4 years child can hop. Hopping is done. Hopping is langdi. So hopping is done at 4 years, while at 5 years of age, skipping is done. Skipping is that ropes that you see people jumping in the gym. So skipping is done at 5 years of age. So these are all the gross motor milestone that occurs in age up to 5 years, and you have to see the patient, this gross motor milestones, and you can notice the patients do all that. Also, patient can throw a ball without falling backwards as a gross motor milestone. Throw a ball without falling backwards at the age of 2 years. So you have to keep that in mind, that at 2 years, the child can also throw a ball without falling backwards. Plus, the child learns to jump at 2 years of age. So you have to keep that in mind, that child can, at 2 years of age, child learns to jump and throws ball without falling backwards. Throws ball without falling backwards. So these are the gross motor milestones and the rules of development. Again, the most in detail milestones are the gross motor milestones. In the next lecture, or the part 2 of this lecture, we will see the fine motor, language, and the psychosocial markers or the developmental markers that we need to see in the children. So I'll see you in the next video, where we discuss the other 3 domains of the development.